Hello and welcome to another episode of Clean Talk. I am your host, Brad Whitchurch. Very excited to have us joined today by Theis Jensen, the founder, co-founder, and CEO of Sani Nudge. Theis, welcome to Clean Talk.
Thank you very much.
Well, it's a pleasure to have you on the show. Maybe you can tell our audience a little bit about yourself and why you're on Clean Talk today.
Sure. So as you already introduced, I helped start a company to battle the challenge of hospital-acquired infections by improving the hand hygiene of healthcare workers. And I think that's why I want to talk today, is to talk a little bit about why hand hygiene matters and what we've been doing in this area to change the outcomes for patients, just like you do.
Well, fantastic. Well, we're really excited to have you on the show today. Maybe you can tell us a little bit about your solution. Of course, hand hygiene is always the focus for infection prevention. The CDC says that is the best way for us to prevent cross-contamination infections, is to have quality hand hygiene. What is Sani Nudge and how does that support that mission?
Yeah, so to explain kind of where we started at, I want to go back to 2015. Back then, I was an engineer and I worked at a consultancy company focusing on helping out on healthcare problems for healthcare institutions. And one of the problems that we were introduced to was this problem of hand hygiene compliance among healthcare workers at a university hospital here in Denmark. But our angle to the problem was a little bit different than most others had. And the reason why was because we had a behavioral scientist among the team. So he really started to focus on what is the core challenge that we're dealing with when we're talking about people's behavior and trying to change that. So instead of tackling the problem from a technological standpoint, we tackled it from a human perspective instead. And I think that is kind of where our focus is a little bit different than the hundreds of different approaches that has been over the last, I would say, 20 to 30 years.
Well, that's very interesting. Explain to us how it works. How are you focusing on the behavioral side of hand hygiene?
Yeah, so the first thing we noticed when speaking with infection preventionists is that they really focus on informing the healthcare workers, training them, giving them feedback, telling them what to do, especially like campaigns, printouts. And they've been doing this for many, many, many years. What they're also doing is that they're trying to understand their compliance by monitoring them. And the way that they do it, even today, is they do it manually. So they will take a pen and they will take a paper, and then they will go around either obviously in person and say, "Hi, I'm going to monitor you now," or they're going to do it the secret shopper way, where they're kind of hiding in the corners and try to see if they can spot someone doing the true behavior of hand hygiene. And where we focused a little bit different was to kind of figure out what are the barriers for the healthcare workers to perform hand hygiene. And I'm not talking about physical behavior barriers such as placement of alcohol dispensers, but more what are the cognitive barriers to perform hand hygiene. And when you're talking about changing behavior, it's not enough to correct it all the time. Actually, the human way of working is that when you get corrected, you actually have a tendency to not remember it. Let me give an example. If I tell you that you're doing something bad, compared to if I'm telling you that you're doing something good, you have a tendency to remember the good part over the bad part. So you will probably not remember if I told you that you were looking really bad the other day, compared to if I told you you look really, really nice. Then you will remember that. And that's the way the human brain take in new learnings the best way. And that's where the term positive reinforcement and nudging comes into the picture. So what we tried to do together with the IPC teams was to start telling the staff every time they did good, instead of telling them when they did bad, as they tend to do, to focus on their misbehavior. And what we saw was that the compliance just slowly rose when we did that. And that linked us to kind of the first true experiments we did, was that we took a existing alcohol dispenser and we made it light up blue when they entered the room so that they kind of noticed that there was a dispenser in the room. And then when they sanitized, it lit up green. Quite simple and not very advanced. But what we saw was that the compliance was not very good the first time they encountered the dispenser. But over time, it slowly improved, doing nothing else but just having a blue and a green light. It didn't light red if they did something bad. It only focused on the good things. And we have kind of used this way of changing behavior ever since in designing the product.
So focusing on positive reinforcement and potentially a dopamine emitter, right? Much like the dings that we get of positive reinforcement from social media, giving a positive reinforcement observation of good behavior to drive better behavior.
Exactly. Yeah.
And now it's done at the local site, as you mentioned, with the green light, which gives you the joy of knowing you've done something good. Is there any type of back end monitoring for compliance, or is that against the ideals of the positive reinforcement?
No. So if you want to change behavior, you need to know the baseline. You need to know where you're starting at. And that is one of the obvious challenges that healthcare facilities have today, is that the way of gathering information of hand hygiene compliance levels today is not giving a true picture. And the reason why is because when you're being monitored, just have a tendency to do better. It's a natural trait of us that if someone looks us over our shoulder, we focus on what we're being judged at doing, so to speak. And this means that when you do the observations today with either the secret shopper or just the in-person monitoring, the compliance levels are typically around 80 to 100%. And recent studies actually show that the average compliance score is more around 30 to 40% in reality. So there is quite a big gap between the usage of direct observation and the true picture of how they comply. So what we do is we do monitor hand hygiene compliance as well, but it's not the focus of the product. It's kind of a side part, and we try not to make it take up too much space of the value it creates, because knowing is just a part of it. It's the improvement that's the importance.
Well, Theis, as we know, hand hygiene so important for quality infection control protocols. A lot of solutions on the market. It's a very fragmented market. People trying to figure out the best way to drive hand hygiene compliance. What kind of data do you have supporting Sani Nudge?
Yeah, and talking about many different solutions. So if you look at the patents that have been filed since, I would say, the 70s, there have been so many different takes on how to do this, how to actually monitor hand hygiene compliance. And in the end, the only thing that works is something that's invisible and that people trust. So building trust in the data is something that we have focused on since the beginning. Really getting the data validated through as many challenges as possible. And to be honest, like the first 3 years, we didn't nail it at all. It's only within the last 3 years that we really saw that the data that we are producing is providing a validated picture of the reality. It's not 100% because technology is never 100%. There are always some sacrifices that you need to make. But when you compare it to the status quo, which is direct observation, it's a completely different league. It's much more reliable. It's much closer to the reality than what you have today. So I think sometimes when you judge these systems, you judge them as if they had to be perfect. But they're not replacing the perfect. They're actually replacing something that is hugely flawed. And so that question about also trusting the data, it's something that is really important to build up when you great solutions like this.
What behavioral aspects are you trying to drive outside of the hand hygiene compliance? I'll give you an example. We've had some infection preventionists on the show who've gotten really creative about positive reinforcement of hand hygiene. Are there steps that you recommend within the facility that the infection control practitioners can implement to try and we've seen some creative infection control practitioners gamifying and making a positive experience from hand hygiene? Is there anything that coordinates with your solution that helps to drive better performance?
Yeah, so it's a journey, and I definitely think there is a lot of things that you can do. So once you have the trust in the system, once you have built the understanding of how the data is presented to the team, then you can start playing around. And I'll say the only thing that we advise is that it has to be fun. Because people like something that's fun. They don't like bureaucracy. They don't like monitoring, tracking. They like something that's fun. So if it's gamification or whatever they come up with, giving cakes or something, it has to be something that's positive. And that's the kind of the key. We try not to tell them what to do, because hospitals are all different. They have different cultures. Something will be very positive and at one side, whereas some other sides might seem that it's, taking up too much of their time, or it might even be challenging for the team to accept whatever is happening. So we encourage them to do something as long as it's fun in their context.
Well, we all love to have fun. And not too long ago, no one would have ever thought of infection prevention as being fun. But we are seeing today infection preventionists getting more creative. And certainly when in conjunction with tools like Sani Nudge, that lends to positive outcomes. What was the COVID experience for your organization? Did you see a COVID bump, or did that provide additional challenges? Certainly pros and cons in the infection prevention space as a result of the COVID pandemic. What was your experience?
So prior to the pandemic, we've mostly been focusing on our home market, so Denmark and the surrounding countries. And when the pandemic hit, we in the beginning thought, okay, now there's really a big need for our technology. We need to go and make a huge impact. Our challenge is that hospitals, they locked down, so no one was able to enter them. And since we have a physical setup that we need to deploy before they can take the advantage of our system, we were actually completely locked out. So what it gave us the opportunity to do instead was we really focus on the research. So we are now starting to publish a lot of the research that we have been creating throughout COVID. Some of the interesting studies that we have show a huge decrease in hospital or in hand hygiene compliance, and a huge increase in hospital-acquired infections during the pandemic. And we're even starting now to continue the curve, looking into what are kind of on the back end of the pandemic when we're looking at hand hygiene compliance. Because I think a lot of maybe not all IPC nurses, but at least some IPC teams, they think that now they don't have an issue with hand hygiene anymore because they learned it through the pandemic. But that is far from the truth. In reality, we are already back at pre-pandemic conditions. Hand hygiene compliance is not improved since then. We also see that facilities are starting to take down dispensers, which seems odd, but in their minds, the dispensers were kind of a crisis installation and not an operational one.